Tell us about this Sure Smile, I think it's called, way doing of orthodontics. Again, tell us why it is so much faster and more precise than before, than the old way of just putting on the braces and tightening them up and tweaking them.
When you put a wire into braces, and braces are really nothing more than the handles on the teeth, the wire straightens out to its original shape. When you have a wire that's straight across, the brackets then line up straight, and anything that is not really exactly normal, the braces are made to fit an average tooth, and very few people have exactly an average tooth. So when the wires are put in, it moves the teeth to where an average tooth would be, but then if you have a tooth that's not average, it's not going to move exactly where it's supposed to. Part of the reason that orthodontics always took 2 or 3 years was that it took at least a year to a year and a half of tweaking and fine-tuning these things of the not so average teeth and things that moved in directions that they weren't supposed to move. And with Sure Smile, we have the ability to anticipate where everything's going to move, and our wires are bent to the point where we go directly from point A to point B. It cuts off a lot of time, not going from point A to point B to C to D to E and back to B. We can actually determine where we're going to go, have very little extraneous movement, and make it a lot more efficient and quicker.
I see. So, can you summarize it? Because there was a lot of information. Can you summarize it in just a minute here of why it is better?
Sure Smile allows us to do virtual orthodontic treatment and using robotic technology to move teeth directly to their final position, which is quicker and more gentle to the patient.
Good enough. Good enough. So that's a new technology, and not every orthodontist has that?
No, that's correct. I think there's about 300 of us in the country that are Sure Smile orthodontists.
Wow. Wow, how many orthodontists are there, more or less?
I think there's about 9,000 orthodontists.
Wow, so that's a very, very small number.
Yeah, we kind of think that we kind of have something a lot different than everybody else, something that at some point in the future will probably become just standard of care. Everybody will be doing it. Right now we're kind of on the cutting edge of some of the things that we're doing. And, with anything that you do on the cutting edge, you always reach some people that, don't want to say it's a good thing to do. But it's been well proven, and we've had probably I know in my practice I've treated over 1,000 cases now throughout the country. It's got to be close to 100,000 cases, if not more. Yeah.
Well, you're right when you say that at the beginning people always, for some reason, fight it. Medical field is very strong in that. I remember having read that there was long time ago, I don't know how many 100 years ago, 100 or 200 years ago, the guy who said blood is circulating, and some doctor said, I'm rather wrong with my idea or with our established idea than with his new idea.
And that's true. It's kind of like the world is flat, right?
Yeah. And I don't know who said it. Most new ideas at the beginning, they're ridiculed, then they're criticized, and then they're accepted as, well, that's normal, of course.
Absolutely. And I'm used to that. I've always kind of been one of those people that likes to try to be on the cutting edge of things, and I feel that I can see things and vision things that sometimes takes a little bit longer for others to do.
Right, but I'm sure your patients love it.
They definitely do.
Wonderful. And that's in the end what counts. The patients being not put through as much hassle, making it as easy as possible, which is not only a human desire, but it's just normal. And especially when it comes to dentistry, saving them time, which obviously saves them money, hassle, headaches, and if the treatment in itself is more comfortable, that is all worth it. And to do your, Cohen technology, the 3D technology, if you see things better and then they become actually in the end more precise, because anybody can put a fence up, but some people put up a really good one, and there is a difference. And if you put a real good fence up there, that's just a difference. Dr. Cohen, thanks a lot.